most common sexually transmitted infection. It causes an ocular infection called trachoma, which is the leading infectious cause of blindness worldwide. In female, the cervix is the automatic site that is most commonly infected. This can manifest as cervicitis, urethritis, pelvic inflammatory disease, perihepatitis, or prostatitis. Chlamydia infections in women, especially if untreated, increase the risk of infertility and ectopic pregnancy.
So, the CDC recommends yearly chlamydia screening for all sexually active women under the age of 25 as well as for older women with risk factors such as new or multiple sex partners. Unfortunately, the recent reports shows that less than half of the sexually active women under the age of 25 are screened for chlamydia. In part of a lack of awareness among healthcare providers, if you are not offered a chlamydia test, you may want to request one from your healthcare provider. If you test positive and are treated, it is important that your partner receive treatment in order to prevent reinfection.
Cause of chlamydia. Chlamydia. Chlamydia is a commonly sexually transmitted disease. It is caused by bacteria called Chlamydia trachomatis. It can infect both men and women. Women can get chlamydia in the cervix, rectum, or throat. Men can get chlamydia in the urethra or inside the penis, rectum, or torso. You can get chlamydia during oral, vaginal, or anal sex with someone who has the infection. A woman can also pass chlamydia to her baby during childbirth. If you had been a chlamydia and you were treated in the past, you can get reinfected if you have unprotected sex with someone who has it.
So how does chlamydia affect the body? So chlamydia can cause cervicitis, urethritis, and proctitis in both men and women. It is necessary to recognize the short-term effects which help in getting early treatment. However, if chlamydia infection is not diagnosed early or is not treated properly, it leads to long-term serious effects as follow. So the long-term effects of chlamydia in women is women with untreated chlamydia face serious complications to the reproductive system such as pelvic inflammatory disease. A pelvic inflammatory disease or PID is an infection of a woman's reproductive organs. It is complication often caused by STDs like chlamydia and gonorrhea. Other infections that are not sexually transmitted can also cause PID. When chlamydia is not detected, it causes inflammation of the cervix, which leads to foul-smelling vaginal discharge, pain during sexual intercourse, and bleeding between periods. There is pain experienced in the lower abdomen. As chlamydia spread to the upper reproductive tract, it causes infection in the uterus, fallopian tubes, and ovaries. This results in swelling and scarring of the tissues. The scarred tissues block the fallopian tubes, due to which there is no movement of eggs, and it prevents fertilization to occur. Thus, the long-term effect of untreated chlamydia in women is infertility or problem in getting pregnant. Further, it can lead to ectopic pregnancy, recurrent miscarriage, stillbirth, chronic pelvic pain, and even death. Short-term and early symptoms in women include fever, abnormal vaginal discharge, vaginal bleeding on contact or during intercourse, and burning sensation during urinations, while infected men show symptoms such as fever, abnormal discharge from penis, burning sensation during urination. Rare cases exhibit pain and swelling of testicles. If rectus is affected in both sexes, there is rectal discharge, bleeding, and pain.
Maybe we can catch a person before they get chlamydia. Now, how can we do to prevent having the disease at the first place? It is the way. First is to stop transmission. So we need to stop spreading of chlamydia from one infected person to another. Remember that there are several ways we can transmit chlamydia. Is mainly through sex, and that involve vaginal, anal, and oral sex. To prevent transmission of these three is by using condom, so that we can decrease the amount direct contact between infected and uninfected person. Next, get tested regularly for sexual transmitted infections or STIs with new partners, or avoid having oral sex or use protection during oral sex until a partner has been screened STI. Also, wash genitalia with soap and water after having sexual activity. This is a universal practice precaution. Lastly is to practice safe sex.
So how chlamydia can be cured? Chlamydia can be cured with antibiotics. HIV persons with chlamydia should receive the same treatment as those who are HIV negative. Person with chlamydia should abstain from sexual activity for 7 days after a single dose of antibiotics or until completion of a 7-day course of antibiotics to prevent spreading of the infection to partners. It is important to take all the medication prescribed to cure chlamydia. Medication for chlamydia should not be shared with anyone. Although medication will stop the infection, it will not repair any permanent damage done by disease. If a person's symptoms continue for more than few days after receiving treatment, he or she should return to a healthcare provider to be re-evaluated. Women whose sex partners have not been appropriately treated are at high risk reinfection. Having a multiple chlamydia infections increases woman risk serious reproductive health complications, including pelvic inflammatory disease and ectopic pregnancy. Women and men with chlamydia should be retested about 3 months after treatment of an initial infection, regardless of whether they believe that their sex partners were successfully treated. Infants infected with chlamydia may develop ophthalmia, neonatorium conjunctivitis, or pneumonia. Chlamydia infection of infant can be treated with antibiotics.